All right, Dr. J. So can you share what exactly happens to someone when they experience trauma, when they have cPTSD or somatic pain?
Yeah, absolutely. So trauma, especially developmental trauma, actually changes the way the nervous system develops. So research has shown that it's actually akin to a traumatic brain injury or a series of traumatic brain injuries or events in terms of how the brain develops. But something that often gets missed with PTSD, or especially chronic or cPTSD, complex PTSD, is that the autonomic nervous system also develops improperly. Generally, this presents as either getting stuck in fight or flight, which is sympathetic dominance or sympathetic overload, or eventually over time, or if a person is just kind of built this way, it can show up as what we call dorsal vagal shutdown or the freeze and fawn response. So the autonomic nervous system and the brain develop essentially improperly, especially with developmental trauma or repeated traumas throughout a lifetime. So these pathways get frozen or stuck in the nervous system as we get older. And the more we repeat the pattern, which is very common with complex chronic PTSD, is that in an attempt to try to heal ourselves, we keep putting ourselves in situations that trigger the same initial trauma in order to try to heal it. But unfortunately, it usually just makes it worse. We're trying to adjust or heal something within ourselves unconsciously, but we're not bringing conscious awareness to it. So we just keep repeating these unhelpful things and essentially making it worse. It's very common. I hear it from patients all the time. So that's why it's very helpful to have some sort of chemical catalyst or neuroplastogen alongside other healing modalities to literally be able to rewrite these scripts in the nervous system, which is what essentially root cause healing is rewriting these scripts in the nervous system and changing the nervous system so that it's no longer stuck in these unhelpful patterns. Somatic pain in particular is a manifestation of what I always call stuffing our issues in the tissues. So whatever emotions are not processed, they have to go somewhere. And if we're not expressing them, or if we're not feeling safe enough to express those emotions, then we generally stuff them down and it presents as pain. That can show up as pain anywhere in the body, whether digestive pain, organ pain, musculoskeletal pain, any kind of pain. But usually the pain is inexplicable, meaning imaging studies are normal, nerve conduction studies are normal. All conventional workup would say we don't know what's causing your pain. Often that's eventually diagnosed as fibromyalgia or something else. But basically, if somebody does have somatic pain and they're not working with the nervous system and the initial trauma that caused it, or that is the root of that pain, then the pain doesn't get better. It doesn't respond to conventional pain management. It doesn't respond to exercise or stretching or other than very specific modalities, which we'll get into. It just seems like nothing will move it. And again, that's because it's not that it's not real. It's very real. It's in the nervous system, but the source is an emotional charge that needs to be released from the system and processed on a conscious level so that it magically goes away. It's not magic. It's just being processed via the mind, which was what started it all.
Got it. Thanks. Okay, so many follow-up questions I have here. Just one quick one I wanted to tag on to this one. How does someone know if they are in fight or flight or if they're in freeze and shutdown?
Really good question. So most people know if they're stuck in fight or flight because they feel constantly on edge, constantly on guard, constantly maybe paranoid, fearful, a lot of anxiety, just a lot of fear. And also that fight component, maybe very agitated, difficult to deal with, looking for a fight, looking for a reason to be upset, or even if they're not looking for a reason, very easily triggered into feeling unsafe and either wanting to run, which is that fear response, or wanting to fight. And often it's internal triggers. So it's not even a situation. It's just feelings of constant stress. Or it could be situational, in a relationship or a work trigger or any sort of stressor. It's kind of an overreaction to whatever that trigger is. So that's generally fight or flight. And most people know, and that hypervigilance of, looking over one's shoulder or just not feeling safe in their body or in relationship or in the public, things like that. I would say the dorsal vagal shutdown or the freeze and fawn response is sometimes more difficult to identify because it's very commonly, all of these are very commonly misdiagnosed as other mental health issues. But the dorsal vagal shutdown is very frequently misdiagnosed as depression or illness, like chronic illness, excess somnolence or sleepiness, feeling just like you want to curl up in bed and not do anything, just being really stuck, almost like when we get really sick with an infection and we need to curl up in bed and just sleep for a few days. That's a normal dorsal vagal response. That's our body's autonomic nervous system way of dealing with an acute infection. But again, people can get stuck in that state where they can no longer mobilize. They can no longer find the motivation or focus to initiate tasks, to do what they need to do, to get out of bed, to go be social, to connect with people. And again, something that also gets missed is there's this fawning that happens with other people. So rather than that kind of fight response, it's people pleasing. It's wanting to make everybody else happy. It's wanting to, again, it generally is a response to childhood trauma where someone was trained, usually by a parent or caregiver, that they have to take on the caretaking role of somebody else. So often people, their whole focus becomes on being a peacekeeper or making other people happy or worrying about other people and how they're doing and not tending to oneself. And again, that fawning, or it's not this genuine like, oh, I want to help build my friend up because they're struggling. It's a way to feel safe and accepted, even if it's not genuine. They might not even really like the person, but they're trying to appease the person to gain safety, essentially.
Yeah. Okay. So we're going to talk a lot about root cause healing for these things in the next questions. Thank you. It's a very, very good explanation.